Awesome. We are live. Welcome, everyone, to this month's Public Health Roundtable Live. We're excited to have this conversation. In all honesty, we were having a great chat kind of backstage, and then I said, okay, we have to go live. So this is going to be great, as always. Every month, we come together. Sometimes the panelists will look a little different, but we host the Public Health Roundtable Live discussion, and we pick a different topic each month to focus our attention on and share our thought leadership. So this is May 1st. It is Mental Health Awareness Month, and you may be watching or listening to this conversation at some other month, but every month is important for this discussion and this topic. We're just in the month of May highlighting it. So even if you're listening to this or watching this later, don't think, oh, well, that's expired information or old information. It's relevant regardless. So one thing we'll ask you to do right now is share this recording, this whatever it is you're listening to, the video, the audio, share it so that to your network, just reshare it on LinkedIn so that others in your network can join in the conversation. We invite you to join in the chat. This is a very interactive, engaging conversation. And then we want it to live far beyond just our few minutes we're going to be with you live. We'll come back to the comments and engage and interact with you long after the live ends. So feel free to jump in the comments, say hello, let us know where you're from. We love that kind of stuff too, as well. So let me introduce myself, and then we'll go around the table, let all the panelists introduce themselves, and then we'll dive into our topic. So my name is Dr. Charlotte Huntley, and I'm the CEO of DrCHHuntley LLC. It's a public health consulting firm where we support BIPOC nonprofit organizations or government agencies that are really genuinely looking to build connection with BIPOC communities. And our support is can look a variety of different ways, but ultimately we are helping them to communicate their health information in plain language to the communities they serve. I host the podcast, Public Health Epidemiology Conversations podcast, and we also support public health entrepreneurs as well. So I am going to pass this over to LaShonda. Go ahead and introduce yourself.
Hello, everyone. My name is LaShonda Richardson. I am the founder of Emerge Public Health and Community Development. Emerge is designed to educate, to motivate, empower, restore, grow, and evolve. I help businesses and organizations with program planning and resource evaluation. Our complete goal is to reduce health disparities and to allow people to have the resources that allow them to make informed decisions about their health and wellness. I also work with the community. I facilitate, manage, and plan for health and wellness community events. So I'm very glad to be here today for the discussion.
Thank you for that introduction. And Kristi McClamroch, you go next.
Okay. Hi, everybody. Happy to be here. So, I am a public health entrepreneur, and I've just been working on a brand new project, which I'm really excited about. I'm writing a book about the transmission of intergenerational trauma in 5 generations in my family. So kind of a memoir case study of trauma and how it can be passed down. It can be almost like inherited through different generations. So it's my new project, and I'm very excited about it. And I'm very happy to be here to be able to talk a little bit about it. Thank you so much.
Thank you, Kristi. And last but not least, we have Ericka Horne. Please introduce yourself.
Sure. Good afternoon, everyone. I am Ericka Horne. It is also just a great honor to be here. I am the CEO and founder of Akiri Consulting, LLC. And with my organization, I have the opportunity to work with nonprofits, faith-based organizations, and provide health and wellness planning for community events. I also have the opportunity to provide trainings in different aspects. I'm a mental health first aid instructor, and with that, I'm able to provide these trainings to not only adults, but also provide some insight and speaking to young adults as well. I'm also a mentor within our community for youth. So I've been able to do different events with youth and provide mental health trainings and just support and providing an outlet and a safe space to provide resources to these different communities that I get to engage with and work with on a daily. I love it. I love everything that I get to do, and I'm excited to be here and to share this amazing topic, especially as a certified health education specialist. So that being my niche and loving to educate others, I'm really excited about today's conversation.
Thank you for that introduction. Yeah, this is all of you are fantastic, and I'm really excited to be able to hear from each of you on the question. I'm going to share it in the just as on our screen here, the question that I'm going to ask each of you to share. And again, this goes for anybody who's joining us live. If you're watching the replay, you can also share your response to this question in the comments. We really want to hear from you. And the question is, how are we discussing mental health on a community level? Really meeting people where they are. We have to put this into a couple things into context. You have to think about who is your community. Your community as a professional, maybe your colleagues, other organizational leaders. It could be other, on a higher professional level of whatever your niche is. It could be other public health professionals, or it could be a different niche of professionals, or it could be the individual community members that you're aiming to serve, and probably any other type of category in between. So, you really think about it. If you think about it, even on a personal level, your community could be your family and your friends. So, we need to put that into context when we think about, the community on this community level. And then, of course, meeting them where they are, again, will look very different. If we're talking about those professionals in public health, or even those like mental health professionals, then that's a different conversation than the individual community member or family member who may not be a, public health or health professional or mental health professional. So all of that being said, I would like to just start with a very little brief statistic, or just kind of an overview. This is from NAMI, and it is, I'm just going to kind of read from here. If you have a mental health condition, you're not alone. 1 in 5 American adults experiences some form of mental illness in any given year. And across the population, 1 in every 20 adults is living with a serious mental health condition, such as schizophrenia, bipolar, or long-term recurring major depression. One of the things the reason I wanted to start there, and this, mental health awareness month of May, I read started back in, I think it's 1949. And one of the big goals is, along with, heightening awareness and education is, really getting rid of eliminating the stigma that goes with mental health. So for me, as I thought about this question, and this topic, because we serve large nonprofit organizations that are BIPOC focused, so they're really focus their attention on Black, Indigenous, and people of color. We really have a heart for serving those organizations. I think about the stigma and that challenge, really trying to eradicate the stigma around mental health or mental illness. When you're talking about any of those communities that we serve, I think it's just amplified. It adds so much, like a heavier layer to the challenge. So one of the things that I do, and honestly, I've really elevated this in this year, is leading with vulnerability. So my willingness to be vulnerable with my leaders in this organization goes so much farther in terms of building connection, and which ultimately helps to kind of break that, start to break that stigma. When I let them see that, I can relate, and how I relate, the more I relate to them, and the more I'm willing to pull back the veil and kind of share on that level, really goes leaps and bounds with helping to eradicate that stigma. So for example, many of you may be familiar with this if you're, in my community or connect with me. I lost my mother at the end of last year. So it was toward the end of the summer last year. And that was such an incredible, that was the only parent I knew. My father passed away before I was born, and my mother never remarried. So it wasn't that I had a bad relationship with my father. I just had no father figure. So that was the only parent I knew. And even though I'm in my 50s, when I lost my mother, it was, and she had been sick for a while. There's nothing that can prepare you for that. So it was an emotional roller coaster. I knew I wanted to have a therapist that specialized in grief to kind of navigate that journey with me. And it wasn't the first time had worked with a therapist. So, but I found a great person, and literally I told her, like, probably about a month in, I said, we're going to be in a very long-term relationship. Because one of the things I learned is that, I guess became like really aware to me, is we don't need to wait for something to happen to get that type of support. So what if I could do something different? I would have always had someone like that in my life. Like, we go to primary care for our physical conditions. Why not have, our group of therapists or mental health support professionals always on, like, as a regular check-in, on as an ongoing thing. So I share that very openly because that is the kind of example that I think BIPOC, leaders, individuals, we need to embrace that in a way of kind of, breaking the stigma. I'm going to pass the mic over to LaShonda, because LaShonda, I would love to hear from you on this topic, and how are you discussing mental health on a community level, especially with the work that you do and really meeting people where they are.
Yeah, so I think the main thing with working with the community is connecting. I think it is connecting, it is listening and understanding the perspective and just kind of respecting the perspective that people are coming from. There are so many people with different backgrounds. And sometimes how people were raised, even, in my background, in my family, it was, kind of what goes on in the house or what goes on in the family stays in the family. It's a tradition. You don't tell the family business, or if something happens, you just kind of keep it. So sometimes people are reluctant to share. And then you mentioned the stigma that comes around mental health, and people reaching out and trying and not feeling like they're crazy or something's wrong with them because they're going to see a therapist or something like that. So just listening and understanding what their perspective is and how they understand what mental health is, and what they're willing to do um, to to help them um, combat the mental illness, or combat, something that may be going on, and giving them actual skills to be able to cope with things, because someone may not be willing to go see a therapist right away, but having those skills and having those things that we can teach people on how to relax or reduce stress, or anything like that. So giving them the skills and the tools and the education to be able to cope with things that they are going through. So that's what I do. I try to connect and try to understand and listen and meet them where they are, and just truly respect the perspective and where they're coming from and what they're willing to do to cope with what they're going through.
Yeah, that's well said. And also, especially the part you mentioned, um, about the not willingness, some people aren't willing to, the stigma of, you know, just talking openly, that's, family business. You don't talk about that. Um, and some people are not willing to make any, steps in that direction. But a key thing you said, that stood out for me, is like holding space to hear them. Let people express how they feel about it without any interruption and without any judgment. I was in a situation like that not too long ago, where five people in this conversation, and one made it really clear, I'm not doing that. I had a bad experience. I tried that before. I'm not doing this. I'm not going that route. And we gave her the space to speak her mind on that without judgment, and other people shared their experiences. The interesting thing that happened is that one who was very resistant actually listened. I think she felt comfortable in the room, and she was willing to listen to other people's stories, because she was heard. she had space to say, give her objections and without judgment. So then she was at least willing to listen. So I felt like that goes a long way, because people process very different pace. They may never take the step, but then the next conversation, they're not going to necessarily react or respond the same way that maybe they would have. They don't feel as guarded. So I think that could go a long way there as well. Um, Kristi, I'd love to hear from you on this question. How are you discussing mental health on a community level? Meeting them where they are. What does this mean for you?
Yeah. Well, Charlotte, I was thinking when you were speaking before, I also lost my mom this year. I know that's a journey that you and I have actually been on together, and have been able to talk about that process and grief. So I was really fortunate that I had a chance to talk to my mom about my idea for the book before she died. And to say, I really want to write this story. It's like a memoir. I want to write about our family history. And I
think we lost our connection with Kristi. A moment.
Can you hear me?
There you go.
There I am.
We felt like there's a little glitch. You're back.
That was a little glitchy. I don't know why that was glitchy. No, just so it's the story follows her grandparents and her parents, and then she and my dad, my husband and I, and then our daughter. So those are the 5 generations. And a lot of this is sort of around some of my mom's experiences. And so, to be able to say, I really want to write this book because I feel like this could be helpful for other people who have either experienced trauma or experienced intergenerational transmission of trauma, or have loved ones who have experienced either of those things. And I felt really vulnerable asking her that question, because it was like, I kind of want to, put our family stuff out there. And her response was, if my experience can help one other person, Kristi, you have to write that book. And which meant so much to me. And so I do think that there is a lot of power in speaking out. That's part of what, I want to do. And sure, there are moments where I feel like I'm like unzipping myself and like, opening up my insides. Yeah. And that's okay, because I think that is part of the way that we can reach our communities, I think that's really important. So that's my approach. And certainly with my public health lens, telling this story, I think, is going to be relatable to people in a different way than maybe other people who have told stories like this, because I bring this public health perspective. I think that's kind of a new take on this, and I think that could be powerful too. So, yeah, this topic is so important to me, and I also, I've been in therapy for a long time and with lots of support, and that's been like a saving grace for me and for the people in my family. And also, I just want to say that, the story is not just about the difficult times. It's also a story about breaking the chains of this transmission of trauma. So it's about resilience and it's about connection. I love, LaShonda, that you use the word connection. I think that's really important. It's about strength and it's about healing. And so hopefully it will help other people be able to move through the difficulties that they may be having in their families. So.
Well, thank you for that, Kristi. I'm sitting here thinking to myself, that takes an incredible amount of courage, to first of all, like we mentioned, like to be able to connect and to track and account for 5 generations
Yeah.
is one, but also then to say, I want to take this very personal, very private. For some people, you can't even talk about it within the family, but now you're willing to take those lessons and share that publicly in a way that can help other people. That's huge. I'm looking forward to next year, Mental Health Awareness Month, to kind of see the progress and where you are,
Yes.
and to kind of each year as you get stories back from people who read that book and how it's transformational. So, um, a very relatable way, through a book, it's
Yeah.
wonderful.
And
Um,
I mean, this, Charlotte, that like I have tattooed on my forearm freedom and courage and connection and kindness. That is my vision for my life. That is what I orient myself around every time I
yeah,
look at my arm. And so, yeah, this is exactly the kind of thing that we're talking about. So I am
yeah.
working on my courage.
Well, now we're going to go over to Ericka. I would love to hear your response here on we're discussing, how are you discussing mental health on a community level and, meeting people where they are, because you are doing this so well in so many different ways. And actually, we had this discussion a year ago. So I really want to hear from you. So I'm going to hand the mic over to you to respond.
Thank you so much. It truly is great hearing everyone else's responses with regards to how we are discussing mental health in our respective communities. I know for me, I'm continuing to do some of the same things that I'm doing. I'm really focusing on providing that safe space for people. And in addition to providing that safe space, being that open, transparent person that's vulnerable in those communities that I am a part of, being able to provide mental health first aid, because in addition to just awareness about what it is, what the training offers is looking for signs and symptoms. If you see someone that may be going down a path, and a lot of times because people don't know what that looks like, they'll see someone who they say, oh, they've just been sad, or they've just been erratic, or their behavior seems odd, but not being able to pinpoint them and connect them to the resources. So I think as we continue to have these conversations about mental health and awareness, it makes it more normalized. And if we're going to continue to break the stigma around mental health in our communities, we have to normalize the conversations around mental health. I really love what you mentioned about, having mental health support. One of the things that I first talk about, even if I'm doing just a conversation with youth, is, I ask them, I'm like, hey, do you guys go to the doctor regularly? And everybody like raises their hand. I'm like, well, who's, talks to like a therapist regularly? And you'll see maybe like 10% of the room that raises their hand. And I, will try to bring it back. I'm like, well, mental health is just having mental health. It's just like physical health, but you go to the doctor regularly for your checkup. So why aren't you speaking to someone regularly? And just trying to break the stigma around like speaking to a counselor or speaking to a therapist, and having a support system that's there to talk with you. And even if in the areas and the communities I work with, we do have lots of access issues and barriers without insurance, or insurance doesn't cover it. So just providing them with an arsenal of tools that they can do to help with their mental wellness as they're on their journey through life. So I really love that opportunity to provide that safe space and just kind of make it normal, especially when I get to work with the youth, because as we're normalizing it in their age, they get to grow with an understanding that mental health is normal to have. And if there's something wrong, just like if I feel sick or my arm hurts, I'm going to the doctor. I feel sad, if that's the word they want to use. I feel odd. Something just doesn't seem right. Okay, well, I need to go speak with someone. And even if you don't have, a therapist or a counselor, find a trusted adult, find a trusted friend. Who's that person in your circle that gives you sound wisdom, that gives you wisdom that you can trust, that isn't going to steer you down the wrong path. So really normalizing those conversations around what mental health is overall, to help destigmatize it. So that's one of the great parts about working with the youth. And then also with the faith-based organizations, being able to train our leaders, whether they're pastors or they're ministers, or if whatever their faith may be, whoever their leader is, and just making them aware of, hey, these are some things to look for. Have you noticed these in your parishioners? Have you noticed these in your members? This person, you're able to notice that they've been erratic, and just showing them different things to look for so they're aware, and letting them know, like, hey, these are resources available to you. You can provide these to your congregation. You can provide these to people, and just normalizing the conversation. So I think when it comes to meeting them where they are, it's going into the community, to the places that they already visit. It's not creating a whole new event for them, because if they're already not going to regular health fairs, that if that does not work for the communities we're trying to reach or that I get to work with, then I have to show up to their community meetings. I have to show up to when they have a school board meeting, to when there's a city commissioner meeting, a county commissioner meeting, when there's a neighborhood association meeting. So it's showing up to those spaces, and then just being that listening ear. Even if I'm not telling them the hat that I'm wearing, I'm not saying, hey, I'm a mental health first aid instructor. Whenever someone says something, I operate in that hat. I just go ahead and I provide the resources or connect them to resources locally. And you mentioned NAMI earlier, and we have a Tallahassee chapter, and I'm always referring people there. I know people on the board for our local chapter, and I get to do engagements with them as well. So just knowing who provides those resources in the communities, connecting with them, and then being able to share my story. So just talking about our vulnerability, being able to tell them about my time currently in therapy, why I started, and normalizing that, hey, you see somebody that you think is doing so well in life. They seem one way, they appear one way to you on social media or wherever you may see them, at school, at work, and then just say, hey, yeah, I have a therapist. I went because of this issue. I went because I didn't know how to be around a whole new school. I started a new program. I'm in a whole new area of life. I needed someone to talk to about that change, and saying it's okay. And they're like, oh, so you don't have to be sick, or you don't have to have a certain illness or disease that they think you need to have to see a therapist or a counselor. And just saying that this is normal. It's okay to talk to someone. So I get to show up as myself. I get to pour that into others. I get to be vulnerable before others, and I get to connect them to resources that they need, that are local to them, that they may not have known. And if all else fails, I refer them to, the crisis hotline, 988. Go ahead, save it in your phone. So that if you are in crisis mode, if you need someone to talk to, you can text that line. They have someone available 24/7. But just letting them know, even if you don't feel like you have somebody, connecting them to the resources that are local to them. And those are ways that I get to show up and discuss mental health in the communities that I'm a part of.
All of that was wonderful. I just, all of you had such great things to share, and there's such an intertwining and so much overlap. And I want to keep talking about it, and I have to keep being mindful of our time. Um, so what I'm going to just say here is, and I want to give you all a chance to kind of share your final thoughts around here. Um, but this is, I think of this as more of a like beginning, a springboard, and it needs to just continue. Like, thinking of ways for myself, how do I continue to share this in a way? Because it doesn't mean being so like you put all your business out there. That's like different, but being yourself, and letting this be a part of, the overall, the whole holistic view of what people, when they engage with you, what they're experiencing. I also am mindful that, we're all sharing very bold examples. We are leading in very bold ways. We're deciding to be, very vulnerable and using courage. And people may want to do something and think, well, I can't do what they're talking about, so maybe I don't do anything. And I don't want that to be the case either. So I have, Amber is in the chat. Amber, if you add the link, to the NAMI link that I asked you to share, with everyone in the comments. I went to NAMI's site. They have a fantastic toolkit, and it includes, we're all, I mean, I love NAMI also for our local area, and I've, shared the resources over the years. But you can connect with your local area, through the website. But this toolkit is I think it's great because it gives you so many different ways to break this down and make it bite size. You could find your way to share in Mental Health Awareness Month, or your way you could take something from this toolkit and find a way to share with your community, and in some way that aligns with you. If what we're talking about feels a little too overwhelming, or a little, a little bold, if you're just trying to start, I thought this was a great resource for to share on this with this conversation, so people feel like they can dive in wherever they are, as well as also explore the resources of NAMI in your own area. So um, this is a great way to wrap up, but I'm going to give each of you a chance to just kind of share your final thoughts on this before we completely close out. So we'll go to you, LaShonda. What are you?
So it's interesting that you mentioned NAMI, because one of the things that I was going to give as a takeaway was sharing that, like, places like NAMI and Mental Health America and the Substance Abuse and Mental Services Administration have toolkits. Those are two other organizations that share toolkits that we, as community health workers and public health entrepreneurs, or people that work in the community, can share on our social media, so that people are aware that they can, find what works for them, and we can be able to share the information to the community and to our families about mental health. So that is one. And I love also what Ericka was saying about being present, for us as, community health workers and people that are working with the community, being present and showing up, being vulnerable and sharing our experiences. People love authenticity. So if you're able to be, and they can tell when, things aren't quite, that. So just being open and being present and sharing your experiences, and that in turn will help someone else to maybe see where they are, and be able to just get better. That's the goal. So I encourage us to share as much as we can, to continue the work, to educate, and to just continue the interactions that we're having with the community.
Oh, that's wonderful. LaShonda, when you get a chance, I know we're going to end the recording. If you get a chance shortly after, can you add those links to the additional resources in the comments for this video, so people watching can kind of have it all together? That would be great. And Kristi, what are your final thoughts?
So I love that you just said, LaShonda, people love authenticity. And I think that's actually, it's so true. And so being your authentic, genuine self, I mean, that is a way to reach other people, right? Because people are drawn towards, those of us who are sort of being our authentic selves. So I really like that you said that. I think another thing is, as public health professionals, and certainly public health entrepreneurs, I mean, it's easy to say, oh, well, mental health isn't my area. Like, that's not my area. I work in fill in the blank other area. But I think that there is a way, in the same way that I am writing a book with my public health lens, I think it's also possible to do public health with a mental health lens. Even if it's not directly what your focus is, I think it's important for all of us to keep in mind, Ericka, you kept saying that there's physical health and then there's the mental health, and those are both part of your health. They're both part of who we are. And to have that perspective, I think that really strengthens our public health workforce, to be able to really, to hold that in our minds when we're doing the work that we do. So, yeah, thanks.
Yeah, that was great. I love that. Doing public health with that mental health lens. That's really good. And Ericka, what are your final thoughts?
So, what I'm hearing is a theme of vulnerability, authenticity, and dare I say intentionality, being intentional about the way you show up so that we can actually be our best selves. I will leave everyone with just something to consider and to think about, even as we're having a conversation about mental health in our communities, as we're serving the different people that we serve. How are we taking care of our own mental health? Because we can only do so much. We can only pour out so much if we're caring for ourselves. So even if you're listening to the replay or watching it live, consider the ways in which you are and are not, considering your own mental health. And I challenge you to take better care of it. I challenge you to do something different, whether it's go for a walk, whether it's, listen to a short story, whether it's drawing, finding something that feeds your mental health, listening to a self-help book, whatever it is that you as an individual need in your toolkit for your own mental health. Don't take it for granted, because the work that we're doing impacts so many people on a community level, on a state, a national, and a global level. So if we're going to be able to continue to do the work that we're doing, we have to really be intentional about making sure that we are taking care of ourselves so we can show up as our best selves. So I encourage everyone to do that if you aren't already. And then if you do have some tips that you do like, I would, even say share those in the chat as well. What is something that you're going to do that this month that you haven't done before, that you're going to be intentional about addressing your own mental health in a way that's impactful for others? So that's my last thought and takeaway.
Oh, that was so good. Thank you, Ericka. Actually, I'm going to make sure I got a couple things I'm going to add into the chat, because I'm doing some things very intentionally, like you said, for myself. So this has been such a great conversation. I say that every month, right, when we do these discussions, but I really mean it. I think this is exciting to have at the very first day of the month. A lot of resources we're sharing in the comments in the chat. Thank you all for taking time to, well, thank you to our panelists for being here and sharing your thoughts and insights. And thank you for all that joined live, and as well as those who will be watching the replay. All of our names are on the screen. So make sure that if you're not already following or connected with us, that you connect with us on LinkedIn. Share anything that resonates, rises up for you in the comments, so we can continue this discussion. And then, of course, feel free to reach out to any of us individually for anything that we can help support you and your business as well. All right. Thank you all, and I will see you next month.